Okay, fantastic, everybody. Is everybody able to see my screen? Just making sure.
Yes.
Fantastic. All righty. So good afternoon again, everybody, and thank you for joining us today for the implications of the COVID-19 pandemic on the mental health and substance use of youth webinar. My name is Nina Salazar, and I am a project coordinator for the Canadian Centre on Substance Use and Addiction. Before we get started, I would like to acknowledge that the land that on which we gather is the unceded and unsurrendered territory of the Algonquin people. Today, we're going to hear from two speakers, who I will introduce shortly, who will explore how the COVID-19 pandemic has impacted mental health and substance use in young youth people. They will also discuss the challenges that youth continue to face during the pandemic and how youth allies, including educators, parents, and counselors, can provide support. Before I introduce our speakers, I do want to note a few housekeeping items. Please note that all lines will be muted during this call to ensure sound quality. Please note that the videos have been turned off, and we ask that you keep them turned off during the webinar. We will also be recording this webinar, and this will be posted on our website at ccsa.ca/webinars. If you do experience any technical difficulties, please don't hesitate to call TELUS Business Connect meetings technical support at 1-844-626-6638 or send me a quick message on the chat box. Now for our introductions, our first speaker is Alexa Bull. Alexa has a graduate degree in community studies and global change and more than 15 years experience in the nonprofit sector. As a manager of knowledge mobilization for the Opening Minds Initiative at the Mental Health Commission of Canada, she has had the opportunity to work on many projects, including Spark, Seniors Mental Health, Caregiver Engagement, and Headstrong. Alexa is dedicated to seeing knowledge translated into action throughout the mental health and addiction service sectors in a manner that includes and values all voices. Welcome, Alexa. We will also be hearing from Sabrina Jouniaux-Romano, Supervisor at Headphone. Sabrina has a bachelor's degree in social work and in education. After working for several years in group homes and shelters in France, she immigrated to Canada and worked for 5 years on a mental health project for the French Health Network in Nova Scotia before working with children with special needs in the Acadian School Board. She is now a bilingual supervisor for the texting service operated by Headphone and the bilingual master trainer for the mental health first aid basics course for youth and seniors. Thank you for joining us, Sabrina. Now to get started, I'll now turn it over to Alexa.
Good afternoon, everyone. Just bear with me one moment while I share my screen. All right. Can everybody see that okay? Okay. So thanks so much, Nina, for the introduction. We are so happy to be here today with CCSA talking about youth mental health. And in particular, we're focusing in on the lockdown life mental health impacts of COVID-19 on youth in Canada. So I'm here on behalf of the Headstrong and COVID policy response teams from the Mental Health Commission of Canada today. And I'm excited to share some of the things that we have learned during this experience. And I'm also excited to be speaking alongside Sabrina and looking forward to hear from her as well. So at the beginning of the pandemic, when everything sort of changed and we all had to cancel things and there was a lockdown, Headstrong also had to cancel all of our youth programming without really a clear understanding of what was going to happen next. And I'm sure many of you can relate to this experience. And then as time passed, we started to realize that this lockdown situation may not be as temporary as we had originally thought or hoped. And we started to sort of grow a little bit concerned about young people and how they might be coping with all of this and how we might be able to best support them. So we launched a survey called Lockdown Life on April 20th, 2020 with the intention of hearing from youth about their experiences so that we could ensure to effectively inform programming to best support the needs of youth in the current context rather and the context that we had previously been operating in, with an awareness of the types of challenges that they have and are facing, and then look for opportunities as well to build on any resilience that they were demonstrating. So I've mentioned Headstrong quite a few times already in this presentation, so it might be worth mentioning what is Headstrong. So Headstrong is an evidence-based anti-stigma initiative created by the Mental Health Commission of Canada. And this initiative is focused on inspiring youth from ages 12 to 19 years to be brave, reach out, and speak up about mental health. So Headstrong essentially is based on a two-part model for positive change. The first part of that model is the Headstrong Summit. The Headstrong Summit, if you've not heard of one or been to one, is an event that brings together groups of students from various schools to hear stories of hope, recovery, resilience from speakers with lived experience of mental health and or addictions challenges. And this happens throughout Canada in different regions. After the summit experience, the second part of this change initiative kicks in, and that's when we encourage students to create their own Headstrong clubs and chapters at their own schools to increase awareness of mental health and anti-stigma and promote educational activities regarding all of these issues within their own communities. So stigma is the primary focus of Headstrong because it often prevents young people from seeking help for their mental health concerns. So that is why we sort of focus in on a particular subject. And research suggests actually that 40% of parents admit that they wouldn't tell anyone if their child were experiencing a mental health problem. And 5 young people diagnosed with mental health condition and needing support do not receive professional help. So this is why we're really, really focused in on reducing that stigma, because we believe that by equipping youth leaders with knowledge and resources on our own community to take action and raise awareness about mental health. So that's a little bit of background about the program. So a bit of background about COVID-19 before we get into our survey results and what we learned through the survey. So first of all, I believe we all know and understand that the COVID-19 pandemic has had serious global economic and social impacts, and unfortunately continues to alter the lives of many, many people across the globe. Young people are particularly vulnerable to the disruptions that the pandemic has caused, and many are being left behind in education, economic opportunities, health, and well-being during the crucial stage of their development. So it's important to note that there are clear indications that marginalized youth in particular are at risk during COVID-19, both of COVID-19 as well as its impacts and implications, including those on mental health. So this category of marginalized youth can include youth like young refugees, youth living in rural areas, Indigenous, racialized youth, ethnic minorities, young persons with disabilities, and young people of diverse sexual orientations and gender identities. So just really important to note that as a part of all of this. So who responded to our survey? It's important to note right up front that we did not ask for sociodemographic data during this survey. So we did not ask people to specify their sociodemographic background. However, the survey was distributed through Headstrong networks, and we do know that Headstrong networks have diverse representation throughout the country. So Headstrong continues to have a strong record of engaging youth who are from First Nations, Inuit, Métis communities, as well as racialized populations, gender diverse groups, and newcomers. Just as an example, in October 2016, the first Headstrong Summit was held specifically for a First Nations youth community. And since then, we have held over 22 summits where 50 to 100% of participants have been First Nations youth, and these include First Nations speakers. We also have begun working with community organizations focused on immigrant and racialized youth, and we have since held several summits. Since 2019, we've held several summits focused on different communities across the country. So, oh, sorry, hang on. going back. I forgot to mention who actually responded to the survey that we do know about. So in total, there were 137 youth who responded to the survey, and their ages ranged from 14 to 24. So most of the respondents were between 14 and 18, which is actually a key age group for our organization. So we were happy to have that participation. And in terms of geographical regions, most respondents were from Ontario, followed by Alberta, Quebec, Saskatchewan, British Columbia, and then others who were not specified where they were filling out their survey from. So now we get into some of the findings and implications. So we're going to look first at the biggest challenges that youth reported facing during that lockdown period. So on the screen, you can see an overview of the types of responses we received in relation to the biggest challenges faced by youth. So we can see here that 49% of youth reported loneliness and isolation during that lockdown period. School closures and virtual learning was also mentioned at 33%. Limited access to mental health and other health-related supports were reported at 9%. Fears of acquiring COVID-19, whether for oneself or human opportunities. You know, some folks are just turning 16 get into the workforce and that rate, and then other reasons, so various other reasons were reported at 6%. So we can loneliness as being a key challenge, and this is really due to not seeing loved ones or friends either through social gatherings or their regular school environments. And it really highlights the need for youth in person-to-person social connections. Sometimes we can focus on youth as and assume that, oh, it would be fine with just social media. These results in the survey, and we'll get into some more a little bit later on, show that that may not necessarily be true. So given that the pandemic seems like it might continue to be with us in some aspect for some time, and that schools and gathering places may continue to either have closures at times or at least have restrictions, it'll be important to see a balance in interaction and virtual while adhering to safe public health guidelines. Many youth reported school-related concerns during the lockdown period, like having limited engagement with their classmates to be able to clarify assignments and questions, as well as reporting challenges regarding managing their own mental health and school workload while living with their family members. So having limited space, maybe limited access to internet, limited privacy to do their schoolwork was all expressed as a challenge. You know, so it just kind of draws attention to the fact that there's all of this, especially when they are feeling worried about maybe following courses and maintaining their well-being. So although that full-blown lockdown is over, we still experience some other challenges and school closures on an ongoing basis. So what did youth report doing to cope? So this was really interesting to us. We just wanted to explore what youth respondents what skills and resilience they had within themselves to find coping mechanisms during that lockdown period. And the good news is that most youth used a wide range of coping methods to deal with constant changes happening in their surrounding environments. So most youth reported that they were able to cope. 85% of respondents reported that they were indeed able to cope during that period. 7% did report not knowing how to cope, so not having coping skills readily available to them. And 4% were unsure about how to cope. And then a small percent of youth, at 4%, said that they felt that no coping was needed because they weren't struggling with anything. So as you can see in the table on the screen, many respondents reported using a combination of coping methods to help find a balance between staying connected with others and also taking care of their own emotional well-being. So some of the things that were reported as being coping mechanisms that were used by youth throughout the lockdown period were yoga, meditation, exercise, walking outdoors. That's the most common one. And then as well as staying connected with family, friends, and or a counselor. Playing music was brought up, doing artwork, using online resources like TV, Netflix, podcasts. Playing video games was listed there by many youth. Writing, journaling, reading books, or drawing was also mentioned. Using resources given by schools was mentioned. And then a small number of youth reported not being stressed or needing to use coping methods at all. So just interesting to see that they have diverse methods that they were using to cope during that time. And it's sort of a positive thing to see. So continuing along the lines of youth reporting to how they cope, I just wanted to share two different quotes. So the first one says, "I've tried taking breaks, doing light workouts, talking with friends, but at the end of the day, the work is still there and everything I've tried goes down the drain. Sadly, the stress is constant." And then we have another direct quote from a respondent that says, "I have connected with people that I would never in a million years think of talking to. Also, me and my family have gotten to grow closer to each other." So here we have two different types of responses and strategizing around coping mechanisms. So we have one quote where coping mechanisms are tried and maybe the situation is still extremely stressful. And I think we can all relate on a certain level to this quote about how, sometimes the coping mechanisms don't always work if you're carrying a heavy load. And then on the other side of it, we see that new opportunities have arisen throughout this lockdown period. So our findings overall in this area suggest that young people often experience stressful situations differently. So this highlights the importance of better directing youth to a range of existing resources in their communities based on their unique needs. So really taking into the fact that everybody copes with stress differently. No one has been in this pandemic situation before, so there are multiple responses within this age group to coping with this pandemic and with the lockdown situation. So how did youth report staying connected to others? It was important for us to understand how youth are connecting so that we can continue to support them in connecting and continuing to connect, as we can see even earlier on in the survey around social connections being super, super important to young people. The use of various communication methods actually highlights the resilience of young people and their desire to keep their loved ones close despite the barriers that they might face due to physical distancing measures that are in place. So we can see that, the bulk of the respondents use a combination of two or more different communication platforms. We see virtual platforms being listed there. We see social media platforms being a bit smaller than maybe we would have anticipated in the response. And there's a widespread assumption that young people's familiarity with technology makes them feel comfortable using online platforms to connect with others, but we can see here that that's not necessarily true. Many respondents reported feeling distressed despite using a number of online platforms to stay engaged. There's a growing digital divide that I think that is important for us to be aware of between more privileged youth and more marginalized youth, or even between urban youth and rural youth. So sometimes a lot of youth don't have access to the devices, to the data, or the Wi-Fi to be able to properly access these virtual platforms. So this not only prevents them from connecting, but also from learning about different resources and things that might be available to them. So this helps us understand the importance of putting maybe some focus on trying to support marginalized youth in being able to access virtual platforms in different ways. So how did youth report getting help. So we're going toward the end of our survey results now. And, this is a pretty important piece, especially as adults working with youth or service providers, to be aware of how they're getting help so that we can ensure that we're reaching out through the right methods. So as shown here on the screen, youth are using various resources to stay informed about COVID-19, including news about the virus itself, and then also safety measures and mental health resources. So they sought help mostly from online resources. So we see that at 53%, then followed by family at 25%, and then by friends at 4% and school 3%. Young people also turn to a range of other means at 15% to inform themselves. So I don't know about you, but I was a little bit surprised actually to see friends at 4% because I think we always think that youth are getting everything from their peers. So it was interesting to me to see that family was actually at 25% and then online resources at 53%. So overall, respondents indicated knowing where to get help if they needed. So 80% reported knowing exactly where they needed to get help. 17% unfortunately reported not knowing where to turn for help, and 4% were unsure. So these results indicate that most young people are pretty confident in knowing where to seek further information about COVID-19 as well as mental health resources. Although most people felt confident in knowing when they needed help, some did report feeling uncomfortable accessing supports, or that they were actually undeserving of getting help. So we did have some responses where they indicated that they did not deserve the help. So this could be a result of stigma associated with mental health concerns, a lack of support from family members, maybe a lack of support from schools to engage and empower young people to seek out help without fear of judgment from others. There were also youth that reported feeling that there was no point in finding help because it's only a Band-Aid solution and it won't address their underlying causes. So it's really important to know that some respondents indicated that they previously sought supports as well for their mental health, but they're currently not getting the help that they need. So this highlights the importance of really continuing to put effort into reducing stigma around mental health and providing resources and helping young people access those resources when they need them. So where do we go from here? All this data thrown at you today, and what does that all mean really? So, at the end of the day, when we look through the responses and we look through the implications of those responses, there is indeed a reason to hope. Overall, there are reasons for concern and action, of course, but the good news is that many youth are displaying resilience and coping, even in the face of this unique, unprecedented challenge. So the hope is that as adults working with youth, we can ensure we build on and foster resilience in all youth, making sure that no one gets left behind. So for those of us on the ground, being mindful and watchful for youth who may be at higher risk for mental health problems, and fostering mental health promotion activities in schools and communities, maybe getting a little bit creative with virtual environments, trying to reach youth in different ways in light of all the restrictions in the pandemic. Providing young people and families with the tools and resources best to support them are things that all can help support the youth. Based on what we've seen in this survey, families are a key resource for youth based on the data that we've collected. So sharing lots of resources with families is also going to be really, really important. And then for policymakers who are thinking about implications from some of the data collected, strengthening community partnerships and system-level data collection to address COVID-19 impacts and barriers for marginalized youth, and expanding community funding and supports to enhance social networks for youth, to create environments that foster positive mental health and social connection safely within public health regulations are both some important elements to consider to be able to support youth through this pandemic and maintain positive mental health and prevent some mental health problems as well. So Headstrong has used this feedback in our own work to help influence the virtual adaptations of our programs so that we can really continue to support and reach youth across the country effectively as possible with messages of hope and connections to resources. So thank you very much for allowing me to share this information with you today. I know Sabrina is also going to be giving us some great insights into how maybe we can implement some of these things in our everyday work. So I'd like to thank you for your time. You can check out our 2-pager survey results, I believe is going to be shared in the resources, and tips for adults working with youth. And also we have a full policy report based on the survey results that will be released at some point within the next few months. So stay tuned for that as well. Thank you so much.
Thank you, Alexa. We're now going to pass it on to Sabrina.
Good afternoon, everyone. I'm hoping that you can all hear me. Sorry. So I'm going to share a bit what we went through at Kids Headphone during the pandemic and what youth who reached out to us for help did share with us. So compared to 2019, because of COVID and at the very beginning of 2020, and since now, we experienced an increase in volume of 112% right now. From the beginning of the pandemic, and now we've seen an increase by 350% in conversation about COVID itself. Some of the topics that youth shared with us mostly were isolation, anxiety, depression, abuse, because we have to remember that for some youth, school is actually the safe space. So removing school was to let the youth in a home that was not safe for them. Online school was also a big topic for them because some youth didn't have the ability to have a laptop to follow their course the way they wanted to, which brought a lot of stress for them, and body image as well. So at Kids Headphone, we have 2 different services. The first one is the phone counseling, where you can speak on one-on-one with a counselor, a trained counselor. And we also have the texting service where you can speak with a crisis responder. So both of the services, we have approximately 1,200 calls and texts every single day from all across Canada. We have an average of 8 to 10 active rescues. So that is when we fear for the life of someone who has reached out to us and shared some concern. We can also help you find resources in your area with our tool, Resources Around Me, which is available to anyone on our website. So you can go there, and if it's, because sometimes the website can be overwhelming for some youth and they need help. So they reach out to us to have help, to get help, and be able to find a resource in their area. After a call or after a text, some youth said that we did help them to reduce their distress, feel more hopeful. We also have a lot, and since Black Lives Matter, some youth thought that they had a more space, a safe space to talk about racism, how they lived their racism. And what we found is that most of the youth who were sharing their the situation about racism were also sharing that they did feel suicidal. So since the beginning of the pandemic, And I'm going to just do a comparison with 2019, where we had almost 2 million interaction. We are on our way to reach the 4 million interactions in 2020, so we almost doubled our calls and text conversations. What we absolutely needed was to have more staff. We could not answer all the demand for the service, so we had to hire new counselors. We had to double the numbers of crisis responders in the first few months of COVID, and all that was helped us to now be able to answer a call from a youth under 4 minutes, and 91% of all text conversations are answered within 5 minutes of wait time, and the more critics ones are answered under 40 seconds. So it was great for us to have everybody at home. Was actually our luck, because we had more people being able to help, which helped us to answer more people. We also, because of COVID as well, we also launched the crisis text line for adults. So we don't have any restriction for age from now on. You can text depending on no matter of your age, and we also are part of the portal for Wellness Together, where you can find great articles when you can also access online therapy. The results of having more crisis responders and the results of having more people trained to help was having 88% of texters who said that they felt better after a conversation. 78 said that they would not have reached out to anyone else, which for us meant that there was an absolutely need to reach out to someone. And 58% shared that something with us that they never shared with anyone before. So having that space where we don't know you, we cannot see you, actually was a great tool for them to be able to speak freely about what was going on. So on top of having now a crisis text line for adults, we also are piloting an Arabic speaking services for the counseling service. So we have translators at the same time with the counseling service. We are also using Facebook. So for all youth who do not have access to a cell phone, they can now reach the texting service through Messenger. Which is a great way for us to be able to reach out to as many youth as we want. The navigation technology is the chatbot, and it will help you find articles or the right service for your need to be able to help you. And the peer-to-peer support is launching in 2021. This is from Kids Help for Youth. Whoever you are a hero. I mean it. I hope you look at yourself in the mirror and know you are saving lives. I mean that. I'm still feeling upset, but this made me know that there are people for me. Thank you so much. So each texter and each person who is reaching out to us had the ability to say anything, if we helped, if we didn't help, why we didn't help, and sometimes give us an absolutely nice thank you. Just in case you have more questions about the service, I am giving you the email address of the Service and Innovation Chief and Youth Officer. Thank you so much.
Thank you so much, Sabrina. This has been wonderful. I'm just going to share my screen right now. Okay. Fantastic. Well, thank you again, everybody. Thank you, Sabrina. Thank you, Alexa, for presenting your findings and resources. I have provided the list of resources in our chat box as well. We have it up right now. The recording of the webinar will also be available on the CCSA website at ccsa.ca/webinars. We will go ahead and read some of the questions that we have here. Let's take a look here. Okay, so far right now we don't have any questions, but I know that a lot of people have been asking for resources and if they can, reach out to Alexa or Sabrina if they had additional questions in the future. Would that be okay, speakers? Perfect. Awesome. Okay. Well, look at that. Timing went really well. Oh, we have one question coming in right now for Alexa. Okay. Is it possible that youth surveyed were not the most marginalized and so were functioning better than others? I was also surprised to not see anyone note substances as a way to cope.
Yeah, no, substances were not noted as a way to cope. In terms of socio-demographic data, it was not collected as a part of the survey, so there's no way for us to know the socioeconomic or demographic background of those who completed the survey. We do know that the Headstrong program is an incredibly diverse community network. So it was shared within all of those communities, including marginalized communities. However, we have no way of knowing exactly who responded. We do have a survey that we conducted a bit later in the summer as back to school was coming about, which we did with families of youth between the ages of 12 and 19. And that survey, we did collect socio-demographic information. So, and it was a huge response rate. I believe we had almost 500 responses from across the country. And I know just from looking at preliminary data results that there were a lot of diverse populations represented in those responses. I cannot confirm whether that is the same, population that responded to the youth survey or not.
Thank you, Alexa. We have a couple more coming in now. Actually, several coming in now. So we have someone from Sabrina mentioned that Kids Headphone has removed age restrictions on people using the service. Will that remain the case in the future?
I'm sorry, I couldn't hear the question properly.
No, that's okay. I can mention again. You had mentioned that the Kids Headphone has removed age restrictions on people using the service. Will that remain the case in the future?
If for now, yes, absolutely. We are not going to stop having adults text us because we can see the need right now.
Perfect. The next one we have is the Kids Headphone had a classroom training tool to teach students what it is like to reach out to KHP, available prior to the pandemic. Will this be available again, or is it available now?
It should still be on the website.
Okay. Maybe we can get you provide us with a link later on, and I can share this with our participants. Next question is, I'm interested to hear more about Kids Headphone's new Any Age service. What prompted them to instigate this?
So the texting service didn't change. The only thing that changed is the age. So we now have absolutely no restrictions. Whatever is your age, you can reach out for help.
Thank you, Sabrina. Okay, I think that is it for the list of questions. Again, a lot of the comments that we have in here is asking for the slides as well as the recording of the webinar. So I'll make sure to provide that information to everybody as well. Thank you, Sabrina. Thank you, Alexa. We had a little bit of a hiccup this morning, but it all worked out. So have a fantastic day. And again, I want to thank all of our participants as well for joining us today, and have a fantastic, safe day today.
Thank you so much. This was great. Thank you.
Thank you so much. This was wonderful. Have a good day.